broken testing system and who have made it great. And if you don't say it, I'll say it. I want to congratulate all of the people. You have done a fantastic job, and we will see you all tomorrow. Thank you very much. Thank you.
All right, so the President of the United States spending about almost an hour in the Rose Garden right now, updating us on the latest developments. And he started with an important statement saying that he believes the peak will be in another 2 weeks. Presumably then it will begin to go down. He says he's saving at least 1 million, maybe 2 million American lives by going ahead with these new restrictions, these social distancing guidelines, keeping them till the end of April. We've heard earlier in the day from his medical experts there could be 100,000 deaths here in the United States over the next few weeks, maybe as many as 200,000. But the president keeps saying that's obviously a lot less than 2 million deaths. John King, you were listening as closely as anyone to what the president had to say. What stood out to you?
Well, the most important thing by far is the significant turnaround from the president on the policy goals. The president now saying America is on lockdown at least through the month of April, possibly longer. He says his job is about saving lives. Bringing the economy back will come after that. That is the most important thing by far that has happened at the White House in the last 24 hours. But yet again in that briefing, we see sometimes the president loves to have combat with reporters, especially when they ask questions about accountability. Jim Acosta asked him about his own words at the beginning of this, minimizing things. Mies Alcindor tried to ask him again about the testing issues that we have across the country. She asked a very fair question. South Korea has tested more of its citizens on a per capita basis. That is a fact. The president had his box at the White House today. He likes props, the new Abbott laboratory test. Let's hope it's a game changer. But even on that call with governors again today, a lot of governors said we don't have enough testing kits yet, or we don't have all the pieces of the kits yet to do what we need to do to figure out the scope of this virus in our states. So this is still an issue in the states. The president does not like questions about accountability. Two other quick things. He said at one point there, a month ago, nobody had heard of this. The first case in China was confirmed on January 7th. That's more than a month ago. The first case in the United States in Washington State was confirmed on January 21st, 2 weeks after the case in China. That is 10 weeks ago. That is not a month ago. Another thing, we always see, Wolf, this disconnect. Some of it matters, some of it not so much, but a disconnect between the president and his tone and his top two scientists, Dr. Birx and Dr. Fauci. The president said, I hope it doesn't come back, meaning a cyclical real revival of the virus later this fall, maybe this fall when the school year starts up again. The president says, I hope it doesn't happen. Dr. Fauci comes up and says, you should anticipate it will happen. The president was asked, do you plan to have a nationwide lockdown? So many of these states saying stay-at-home orders. He was asked, should we have a national one of those? He said he didn't think that was necessary because in some places of the country, they don't have it, or they have very little of it, or they're doing just fine. Dr. Birx said she urged every governor and every mayor to think about this because there are still some states and some communities that have no restrictions or very loose restrictions. It is clear his public health team wishes they would ramp those up, but the president won't tell them to do it.
Yeah, even in areas where there are maybe 2 or 3 or 4 cases right now, she specifically said that within a few days they could double. There could be 2, then 4, then 40, and then 400 very, very quickly. That could explode as it has in New York City, for example. So we're watching that closely. I want to go to Jim Acosta, our chief White House correspondent, who was listening very carefully. You were there in the Rose Garden. You asked the president a question he didn't like. He suggested in response to you, Jim, that he simply wanted to keep the country calm. That's why he was making those statements.
That's right. Well, I mean, that was the explanation that the president gave, that he didn't want to cause any panic during the run-up to the crisis we're in the middle of right now, and that was why he was saying things along the lines of everything is under control and that sort of thing. But Wolf, he said it so many times, I think it does raise the question as to whether or not he was either intentionally downplaying the severity of the crisis that was on its way, or he wasn't listening to his medical experts. You'll recall there was a period for a couple of weeks where Dr. Fauci and President Trump were just not on the same page when it came to what was going on as these cases were building up here in the United States. So I asked him about that, pressed him on that. Obviously, he didn't like the question, and at one point he described the job that his administration is doing, the people inside his administration, as being almost a miracle. Obviously, people around the country right now who are going through some pretty difficult times would, I think, disagree with that. It has not been almost a miracle. It's been anything but that, and it seems over the past couple of weeks, what this administration has been trying to do is sort of get its sea legs in responding to this crisis. The other thing we should point out, and I think John King was just mentioning this a few moments ago, when Yamiche Alcindor from PBS was pressing the president on the number of tests in this country, you heard that at the very beginning of this news conference, the president touting the number of tests, Secretary Azar from HHS touting the number of tests that have been rolled out. But as Yamiche was pointing out, we are still far behind what has been done in places like South Korea, where per capita they have conducted many more tests because obviously they have a smaller population. So to be in the same ballpark as the United States, obviously they've been able to blanket their country with the kind of test. And why is that important? As we know, well, from listening to experts like Dr. Fauci, they need that testing to be done around the country, sort of fanned out across many of these hotspots in places like New York, so they have a sense as to how big the problem is in specific parts of the country. That will allow the administration, federal health authorities, and so on to be able to respond to this crisis and this pandemic. They can't do that without adequate testing spread out across the country. And so, Wolf, you know, when the president is called to account for things he has said in the past and the job this administration is doing, he gets very upset about it. At one point he said he wanted to be congratulated for all of this. Obviously, reporters in the Rose Garden covering the White House are not here to congratulate the president. We're here to hold his feet to the fire, Wolf.
All right, good point. Stand by. I want to bring in our Daniel Dale. He's our CNN fact checker. You listen, obviously, Daniel, very closely. Any inaccuracies? What did you hear?
Yeah, so Wolf, what we're seeing from Trump is a pattern now. We've seen this for the last 2 days, where he reflexively denies the premise of a reporter's question, even when the premise is entirely accurate. And so you saw that today with Jim Acosta, who recited quotes to him from before where he repeatedly downplayed the crisis. One of the quotes was that the virus will just go away. And Trump said today, that's true, it is going away. That's a come on, Wolf. I mean, he omitted, when he said that before, the fact that there would be thousands and thousands of deaths before it did eventually, hopefully, go away. And then when Yamiche Alcindor asked him today about South Korea and testing and said, you know, when are we going to get on par in terms of per capita numbers, he reflexively said, it's very much on par. It's not on par at all. As of late last week, South Korea per capita was testing 3 times as many people as the United States was testing. So when Trump keeps denying what reporters are asking him without giving it too much thought, he's often inaccurate in his own denials.
Important point as well. Sanjay Gupta is with us, our chief medical correspondent. From a medical point of view, what stood out to you, Sanjay?
I think there were a few things, Wolf. First of all, this idea that the country, there are places around the country where there are few cases, and just a few days ago, Wolf, there was this idea being floated. Maybe we could start to open up those areas of the country. I thought it was very interesting today. Ambassador Birx actually said, look, when you start to really look at this data, even if there are fewer cases in some of these states, what you're seeing is a pattern, a curve that very much is similar to what we're seeing in other places around the country, these so-called hotspots. Even though it may be earlier in the curve, that's what we're starting to see, and that's why I think she raised some concern. Look, we could have a couple cases now, but it could go to 20, it could go to 400, and that can happen pretty quickly. The president even mentioned that in Louisiana last week, I guess 2 weeks ago, there weren't that many cases, and now it's one of the most, one of the fastest growing in the country in terms of newly diagnosed coronavirus patients. I think this is going to raise this question, Wolf, and I think it's going to have to be answered at some point. Should we keep doing this in a piecemeal fashion around the country? Having all these various curves. In New York, it's expected to peak middle of April, the number of patients with coronavirus. In Florida, middle of May. Could there be other places around the country, like where I am here in Georgia, where they're probably still not doing enough? They don't really have a sort of a broad stay-at-home order here in the state of Georgia. So are we going to see even a later peak there? Is this just going to draw this out further and further? I think that's going to be a big, important question. Wolf, obviously this is a big country, but there have been other countries, smaller, admittedly, that have done these lockdowns and have probably had some good results to show. Also, Wolf, just quickly, because this keeps coming up again and again, this personal protective equipment, why is so much of it being used? I think was a question that was asked a few times today. Look, I can tell you, Wolf, in hospitals, now when you see patients in the emergency room, when you're seeing them on rounds, when you're seeing them in all these various capacities, doctors, nurses, therapists, everyone, they're working under the assumption this patient might have the novel coronavirus. That means every time you're seeing any patient, you have to be wearing personal protective equipment. That's very different than the situation was, obviously a month or 2 months ago. That's why all of a sudden, you need to have 10, 20, 30 times more of this personal protective equipment. I've heard from hospitals that say they've gone through their entire season supply of this equipment within a week or two. So that is part of, I think, what explains this difference in numbers, Wolf, when it comes to PPE.
Yeah, that's a very important point. Sanjay, I'd like you to stand by, everybody to stand by. We have a lot more to assess. And Sanjay, I'm also interested in getting your thoughts